It's National Nurses Week. It continues, actually ends today, and we continue to honor the men and women who work hard keeping us all healthy. During the crisis, they're going above and beyond, no doubt helping save a lot of lives.
Yeah, you know, obviously they are important all the time, but we are really seeing just how critical of a role they play to all of us right now. And on this, the final day of National Nurses Week, Kalyn Norwood shows us how some nurses in Austin are not only helping COVID-19 patients here, but also across the country.
In this crisis, they're on the front lines. I spoke to a nurse here at Del Seton who's been working 12-hour shifts to fight this invisible enemy. We talked about his recent trip to the Midwest and how he was helping patients there. What he told me next is that he was shocked when he returned because the number of COVID-19 patients here had quadrupled. In the fight against COVID-19, nurses are working around the clock to tend to patients. And the fight in Austin is only getting tougher.
Everything that I thought might happen is happening now.
That's John Villasana. He's an ICU nurse for Ascension Seton. He's talking about just how much Austin has changed. In a 2-week period, he says his hospital went from having clear hallways to crowded ones.
And I'll tell you, I didn't see this when I left because we didn't have so many COVID patients. The hallways are crowded. The nurses are working very hard. If you look down the hall at the nurses, you're seeing a lot more activity. You're seeing equipment being rolled in and out of the area. It is a very busy place.
Since March, the number of COVID-19 cases in Austin has steadily increased, and there's now nearly 100 patients in the hospital, with almost half of them in ICU.
Generally, for most critical illnesses, we really know what to do, and we get patients in and out of the ICU routinely. But the COVID situation is different because we don't know what to do, and we're doing everything that we think we should do, and we're not there.
He traveled to Detroit 3 weeks ago to help COVID-19 patients. He says the entire hospital he was at turned into a COVID-19 unit, and nurses got sick.
They got a very severe surge of patients. They were overwhelmed, and their nurses are overworked, understaffed. A lot of them became ill.
Now that he's back, he says he doesn't want to see what's happening in Detroit happen here, and he hopes the community will act accordingly.
If we're not there to take care of them when they get sick, then everyone will suffer.
Villasana said right now nurses are scared. What he didn't anticipate was the high level of anxiety that came with continuously working in an environment where your life is at risk. Reporting near downtown Austin, Kalyn Norwood, KVUE News.